Our health editor Hugh Pym reporting. Well, Francesco Rubino is a professor of metabolic surgery from King's College Hospital in London, and his research in this field contributed partly to those draft guidelines being published by NICE today. Professor Rubino, thank you very much for coming in. How many more people would you imagine will qualify for this operation? Because some estimates put it at over 800,000.
Yes, that's the estimate, but that doesn't mean that everybody will get surgery. To give you an example, today already using NICE guidelines with BMI over 35, you would have only 1% or less, actually probably 0.5% of patients who meet the criteria and eventually actually go on and have surgery. So I don't think there's going to be 1 million persons having surgery all at once. Even
when you're going to potentially reduce the BMI to 30, it still wouldn't be an avalanche of requests.
Yes, well, surgery is a different type of treatment. It's not a pill. So some patients might not necessarily spam. Some physicians might not bring up the option of surgery for some patients. What I think the NICE guidelines are important for is that for the first time in England and the UK, I think physicians now should consider surgery and should inform the patients that this is an option.
But at a time when the NHS is struggling to make ends meet, is proposing a complicated surgery like this really the sensible way to go?
I think it's very sensible, and it's also consistent with the clinical evidence. There's a lot of confusion about using surgery for diabetes, which is an established disease, versus using surgery as a cosmetic option or treatment, or for prevention of something that has to happen. We are talking here about patients with diabetes, with established disease, who are at high risk from huge, important, costly complications, and most importantly also their risk for their own life.
We've had quite a lot of comments from people to the BBC News website, and people have been texting and emailing with their views, some not as sympathetic as others. Here's a relatively sympathetic one. My name's Christopher, I live in Richmond, and he says that he's never had trouble keeping his weight to a healthy level. Some viewers have written to say that they shouldn't have to pay for others' poor choices. I disagree. Don't you think these people are aware of their condition and are trying to do everything they can? Are they? Because the perception is that it's personal responsibility. You've eaten the food, you put the weight on, it's up to you to sort this out.
I think there is a stigma against obese patients, unfortunately. Unlike any other thing, we believe, any other disease, we believe it's the fault of the individual for being in that condition. We are also here talking about diabetes, and I would like to re-emphasize this. We are talking about diabetes, not a precondition that will lead to diabetes. We are talking about patients who already have disease, and whether or not this is coming from a bad lifestyle, it is a disease and needs to be treated.
There are other views which people thought they were going to have to pay for their own surgery. Perhaps their personal choices regarding their diet and exercise would change.
What if I give you an example? Smoking can lead to lung cancer, right? But if patients develop lung cancer, telling patients to stop smoking will not solve the issue. Here is exactly the same thing. It might be that a bad lifestyle or bad food choices may lead to obesity and diabetes, but once you develop the disease, this is a serious condition and needs to be treated appropriately.
But losing weight can mean that some of those symptoms of type 2 diabetes either disappear altogether or certainly improve.
Well, what we know now is that it's not just the weight loss after these operations that takes diabetes away, if you will. It's the operation itself, which has the power of acting on the stomach and the intestine that are involved in the regulation of blood sugar metabolism. And so the reason why diabetes goes away is not as simple as weight loss.
Finally, let's look to the long term then. This might help people who've got type 2 diabetes now. Obviously, we want to surely try to prevent more people developing the disease and so that we all live a healthier lifestyle. Ollie says, we as a society surely have issues with how we treat our bodies through laziness, peer pressure. We all pay into the system. We should be able to access help when we need it. But preventative measures are a must, surely.
I agree. Preventative measures are a must all the time. We don't have to confuse prevention and treatment. What the NICE guidelines are addressing is treatment of disease. Prevention remains diet and lifestyle. There is no question about it.
But how much money is going to be spent on that in addition to money being spent on procedures?
Well, the money that you spend on procedures is money that would otherwise, if you don't spend, would probably end up costing you more. It is a very expensive disease. It costs to the healthcare system very, very much. And if you don't aggressively treat the disease, you're going to have a harm to the patient and a harm also to the national healthcare system.
Professor Francesco Rubino from King's College Hospital in London, thank you very much for your time. Thank you. Israel's